Hey guys, so let's be honest. There is a lot of confusion and misinformation in the medical community surrounding thyroid health. Conventional medicine's methods for diagnosing and treating thyroid conditions rely on outdated information and oftentimes are centered around black and white thinking. And even in the integrative and alternative world, practitioners have focused too narrowly on one or two trendy areas of thyroid health while ignoring the rest. If you have a thyroid condition and are on thyroid medications but still aren't feeling your best, your doctor may be overlooking something very important that is holding you back from living a life full of optimal health. And if you're dealing with fatigue, weight gain, brain fog, hair loss, mood imbalances, constipation, or temperature sensitivity, you could have an undiagnosed thyroid problem that your doctor has missed. So let's break down 7 myths about thyroid disease so you can find out what your doctor may be overlooking. Myth number 1, thyroid dysfunction only affects women. While it's true that women are 5 to 8 times more likely to develop thyroid dysfunction, men are not immune. I've worked with plenty of male patients who are dealing with thyroid issues, so if you're a man dealing with unexplained symptoms, it's definitely worth looking into your thyroid health. Myth number 2, if your labs are normal, your thyroid is fine. I can't say this enough. If you're continuously fatigued, constipated, your hair is falling out, or you feel like you are living in a fog, that is not normal. There is a reason for that. Many conventional doctors are using outdated reference ranges that are looking at normal levels when they should be looking at optimal levels. That's how we all want to feel, is optimal. So if you feel like crap, but your doctor is saying your thyroid is fine or your meds are working, you still could have a problem. Myth number 3, TSH is the only lab that matters. Many conventional doctors rely solely on TSH to evaluate all of your thyroid health, but it doesn't tell you the whole story. We need to see the full picture in order to restore balance, and that's why it's so critical to run a complete thyroid panel. Myth number 4, TRH and TSH don't matter at all. On the flip side, we can't discount TRH and TSH altogether, which is what a lot of integrative and alternative practitioners do. TRH affects everything from your fight or flight response to stomach acid levels, serotonin production, and insulin and blood sugar levels. So it's not something we should ignore. Suppressing your TSH completely is not a good idea. You need to look at the big picture and figure out what's missing. Myth number 5, stress isn't important for managing your thyroid. Along those same lines, your stress hormones have a big impact on your thyroid hormones because they both play a huge role in your endocrine system. If your stress levels are high for a long period of time due to chronic stress, it can suppress thyroid hormone production, keeping your thyroid hormones stuck in their inactive state, and it can even lead to thyroid hormone resistance. Myth number 6, gut health doesn't impact thyroid function. About 20% of your thyroid hormones are actually converted to their inactive state to their active state in your gut. Your digestive tract is also where you absorb all of those vital nutrients that are necessary for optimal thyroid function, like iodine, selenium, zinc, vitamin A, vitamin D, and iron. So if you're dealing with gut imbalances, small intestine bacterial overgrowth, infections like H. pylori, a deficiency in HCl or stomach acid, candida, or any other digestive problem, your thyroid is going to be disrupted. So you need to address the root cause. Myth number 7, giving up gluten is a cure to all thyroid dysfunction. This is a big one floating around on the internet, so I really want to make sure I address it. Yes, it is true that gluten can play a huge role with leaky gut and thyroid dysfunction, especially when you have an autoimmune thyroid problem. And yes, I do recommend that thyroid patients remove gluten from their diet, at least temporarily, to see how your body responds and if your symptoms and lab markers improve. However, as we've learned, there are so many factors that play a role in thyroid function. I wish the fix was as simple as removing gluten, but it's not always the case. We have to look at the whole picture, including labs, stress, gut health, nutrient deficiencies, and even toxins to understand what's truly causing the imbalance so that we can restore optimal function long term. I'm Dr. Seth Osgood, the founder of GrassRoots Functional Medicine, and if you're ready for a whole body approach to reclaiming your health, my team and I are ready to partner with you. I've worked with thousands of people from around the world to help them overcome complex health conditions, and we want to do the same for you. So feel free to check out our website website and even schedule a free 10-minute consult with me so we can discuss what's going on and whether or not our adaptation program would be helpful to you. We are looking for the right patient, so I want to make sure we're right for you and you're right for us. But feel free, again, to check out the website, grassrootsfunctionalmedicine.com, and that's where you can set up that free consult. I wish you the best on your journey to optimal health, and I hope you guys have a blessed day. Thanks again.